Hi, good morning. And I'm Andrew Lowsutea president. How are you? I haven't able to see you for a while. It was good that you can join us again. Well, I'm very sure that you are enjoying the seminar as we move on, because there's a lot more to learn from the seminar. Let me share with you some of the recent letters I received from many of the clients that we have on Lowsutea, and also do listen to my lectures, webinar, and they found that it's very, very helpful. One of the questions they always brought us is, hey, how come my sugar come on go up and down? And also a lot of time it really goes up very high and stay high. What do I do? So that's the reason why I especially made this lecture to let you understand, as a pre-diabetic or diabetes, both you're going to have opportunity. You're going to have suddenly very high blood sugar, which is called a hyperglycemic, and also have low blood sugar as you move on as a diabetes. You're going to have that occasion. And when you have low diabetes, that can be dangerous because low blood sugar, you can be dangerous because of the fact that will be the time that you can suddenly become, very weak. You can even go unconscious, which I saw many patients when I was an ICU ER nurse, actually bang, suddenly just drop on the floor and doesn't wake up. So we have to actually, provide an IV to put sugar, glucose in the bloodstream to and they respond very fast. And sometimes people that still have some conscious, will give them very, very fast some of the glucose sugar candy, and they also can wake up very fast. Even a juice, orange juice, or some kind of sweet drink, they can help. So, these kind of things that is very simple can be done. And so I would like to go through this a little bit more in precise what you can do, so you can get some idea what need to do during the time. And this really can be a life-threatening situation, especially if the person suddenly fainted with hypoglycemia. And you can really see it because they will suddenly get real jittering and somehow, and the time of that, the change could be 10 to 15 minutes, very fast. And, that which you can see, if you want to do something quick, you got to do it within that 10, 15 minutes. If not, then the patient would just bang and fainted and drop, So that is what I think is so important, that you got to have some basic knowledge to help you guys out. So maybe I can start the webinar now and go from there. So let me start. Okay, today we're going to talk about what's the difference of hyperglycemic, which is high blood sugar, and what is the hypoglycemic, which is low blood sugar, the difference, and how do you manage it during the time. And this is a really important webinar because of the fact that don't take it lightly, because at the end of the day, you suddenly say, wow, how come this is really can be an issue? And to be honest, a lot of people don't understand, and they really thought that, well, maybe it's not really to me. But as the time goes on, as the disease process, even in high, people who are only a pre-diabetic, they can have some experience of hypo or hyperglycemic. So you got to really need to recognize that, and it's a common situation. It's not something that only that will, it's really common that people will have that occasion issue that will come along. So that's why I thought this would be a good idea to at least now to look at this and start working, have some idea to look at it and how we can able to get some knowledge base. So let's start. Today we're going to introduce what's hyperglycemic, hypoglycemic, so you get an understanding, and you can have a very distinction understanding what's the difference when you have hyper and when you hypo, and what is symptom and sign that with both situation occurs, and how do you identify that, okay? And how do you manage? What is a strategy? Could be a long term, could be a short term. You gotta know. And how do you prevent it? You get yourself to hyper or hypo. And certainly how Lowsutea can help you along this path. And that's important because Lowsutea might really help you during the hyperglycemic situation. You got to drink a lot of Lowsutea. Just got your sugar down and also get your volume of fluid intake in the blood to thin it out. So that is really a good thing for you to do. And then we can have a conclusion, understand, we'll give you a Q&A so you can ask questions. So basically, that's what we're going to do today. And I think it's going to be a very, very informative, and it's going to help you to understand better. But I saw a lot of people here today are not in the usual group, and they're newcomer. So I just want to make sure to catch them up to everybody at the same database. So I'm going to talk about 4 stages of diabetes. Now, basically, before you become diabetic, how do you get there? Okay. So the first thing, your first stage is usually the LDL, which is the bad cholesterol going up. When the LDL go up, your LDL cholesterol will damage the B cell coming from pancreas. The B cells will take the sugar to the cells to use as a fuel to make energy, right? To make sure that you have fuel to use. Now, when the B cell keep coming out, it damage and damage. Eventually, you're going to have a so-called insulin resistant. The cells don't get the sugar, more sugar in the bloodstream. And then the situation is going to arrive when the cholesterol and the blood sugar mix together, the blood becomes thick. When the blood becomes thick, the problem will occur. And then you very quickly to move to stage 2. Because when the blood becomes thick, you're going to start forming plaques everywhere. You see these plaques? And then plaques form everywhere, and that's the basic of diabetes. They will get plaques everywhere for the entire body, your brain, your heart, your kidney, everywhere. So with that, then your blood pressure goes up because you now have less space in the vessels. And that's, if you have long-term getting this plugged up, you have basically a really bad future issue as you move on in life. Now, unfortunately, during this time, you have no sign and symptom whatsoever. You basically just normal, you do the same life, so you don't do anything. So really, very quickly, 2 to 3 years, you will change yourself to stage 3, which is called a situation. You will come out to have a pre-diabetic situation, whereby your blood sugar will start going up. And so the doctor will continue to measure this everywhere the same. They measure this thing called the HbA1c, because everybody will have a hemoglobin, and then they will attach how many percent of sugar or glucose attached to this hemoglobin. If you're 5.7, you're a normal person, anything below. But if you're over 5.7 to 6.4, you know what? You are pre-diabetic. So you're pre-diabetic, the doctor will say, hey, sir, you're pre-diabetic. You really need to control your diet, maybe do some exercise, change your lifestyle. Unfortunately, with all that, majority people will not understand what to do. So they will continue the same lifestyle, no change, and eventually 3 to 4 years, they will become diabetes. That's why in the stage 3, Lowsutea really can help you. Not only stage 3, actually in stage 1, you can actually drink Lowsutea, can help you lower your blood sugar, cholesterol, and blood pressure. Net result, you will become a much healthier person to help you to prevent you become a diabetes. And that is very, very important. Now, if you become a stage 4, become diabetes, by the way, it's too bad. You will not able to go back to the same old, don't call it diabetes anymore, because once you become a diabetic, the document with diabetic, although your clinically might not show, but your record will have. So net result, you have issue of insurance, high insurance pay, everything. So all that will occur. So anyway, really at the end of the day, in these 4 stages, importantly now what we're trying to do is educate people. In stage 1, we already help you to lower your cholesterol, lower your blood sugar, so you never go to stage 2 and stage 3. Isn't that great? Rather than you get sick, then you start getting treatment, because in stage 3, you have no medication, but you very quickly will eventually move to stage 4. All that will get you to be a very bad stage in health down the road, which you don't want to do. So that's the reason why we try to educate everybody to start them off in stage 1, when you have high cholesterol, blood sugar start moving up, control that. So you never get down to stage 3 pre-diabetic stage. the blood pressure will not go up. Isn't that even better? So I think that's the key that we'll do. Now, why we talk about Lowsutea? Because Lowsutea had 2 items in it. It is not a drug. It's just only a herbal so-called tea. Actually, inside there have no tea leaves. But there are 2 things in there. There's bitter melon and guava leaves. The guava leaves actually delay the absorption into the gut vessels. Bitter melon increase the insulin sensitivity, so take the sugar back to the cells. But insulin is very interesting. They also take excess sugar and cholesterol and sodium, dump it out on urine, and that result, sodium go down, your blood pressure go down. So lower your 3 high, meaning your blood sugar, cholesterol, and blood pressure, all 3 will come down. Plus, it will get you to detox. Many people use also Lowsutea, found out they also lose some weight because it dumped up all the excess fluid and also the fats comes out. So net result is good to continue to drink Lowsutea just as a drink, as a normal fluid like. Now, we really don't want to just get you to drink Lowsutea alone, because really you got to change your lifestyle. And changing a lifestyle meaning that, yes, you got to drink Lowsutea 6 to 8 cups a day, and to lower your blood sugar, cholesterol, bad cholesterol, and blood pressure. But important, you have to also follow a low-carb diet, a low-fat diet. That is so important, because with that, you can definitely help you lower your blood sugar and cholesterol. And you have to exercise. Now, a lot of people do not exercise, then they don't achieve that real good result. Exercise means very easy, 8 to 10,000 steps a day. You can walk in the park, whatever. You have to weight control. You lower 10% of your weight, you lower 1% of A1C. And you listen to our webinar, and it's a free webinar every week. We'll give you one area you can look at and understand. So continue to increase your understanding. Wow, then you become a much better person, how to monitor yourself, how to manage yourself. Isn't that wonderful? Plus, we have a daily blood work tracking that we can give you a sheets. You can actually handwriting, take a blood sugar, and you're able to do all that. So net result, you have a total gamut to understand what you need to do. And at the end of the day, we have a lot of customers who take Lowsutea. The A1C was way up in 10% and drop it down to like 5.7 or under 6. Wow, they become much healthier. The best thing is they change the lifestyle. It's not only the A1C, the whole lifestyle changed. They ate better, low-carb diet, low-fat diet. They don't take a lot of carbs. They don't drink bubble teas anymore. They drink, low sugar tea or coffee. They exercise 10,000 steps, lower their weight. Boy, they become so much healthier. And at the end of the day, they live longer. And they have no more so-called diabetic complications. Isn't that wonderful? And that's what we're trying to do. Now, so let's talk about what is blood glucose, all that thing, and give you some idea what we're doing here. Now, a lot of people say, what is blood sugar? Blood sugar, usually, the medical term is called glucose, blood glucose level. So you have to know what is the blood glucose level. Now, blood sugar level is actually the amount of sugar inside your blood. And it's really the sugar, the glucose is really the main body, the energy to run your body, okay? Without glucose, you are not going to be able to function. So what is the normal range of the blood glucose? So reference for USA, the normal range is 70 to 110 milligram per deal. Now, that is important. If you have in that, you are basically a very healthy person, right? Now, however, if you have type 1 or type 2 diabetes, your blood sugar is kind of goes up. The problem is type 1 is basically they're born without really have a body can able to give you insulin. So they will have to inject insulin artificially every day to maintain, their to help to bring the sugar into the cells. It's because they can't produce or they don't have enough insulin. And that is actually about 5% of the population of diabetes have that. But majority of people of the diabetic, they are actually type 2 diabetic. They have the body basically just not enough insulin to work with all the body intake, or they become aged. They have more insulin resistance, and whatever that come with has. Later we'll talk about why they become a type 2 diabetic. 95% worldwide diabetes person is type 2 diabetes. And that's what we're trying to focus. And you can change not to be a type 2 diabetic. You can prevent that. That's the reason why we really want to make sure you have that possibility and knowledge to prevent yourself go from type 2 diabetic, or prevent yourself to become a type 2 diabetic. And that's what we're trying to do. Prevent you become a type 2 diabetic. Or even if you're a type 2 diabetic, I can put my clinical symptom, everything to back to, to the normal person at pre-diabetic stage. So that is really important. Now, a lot of people, because become type 2, either they're not moving around, they don't exercise, they're overweight, they overeat with a lot of carbs. And so with that just got themselves into this stage. So really, at the end of the day, you can able to prevent it. Now, also in diabetes, you can result of high blood sugar or low blood sugar. So really, at the end of the day, when you have usually type 2 diabetic, most likely you have hyperglycemic, which is the high blood sugar. If you're not treated, you have all kinds of problems. You know why? Because the sugar and the cholesterol mix together, the blood becomes thick. It got blocked all the things all over the body, plaque. And once you got the plaque, it doesn't go back, okay? In other words, this plaque will continue to form. So you got your eyes, your brain, you can have a stroke, you have a heart attack, you can have nerve damage, you can have kidney failure, which you have to require dialysis. You're going to have wound cannot heal, you have to cut out a foot. Man, you don't want to be in that road, because I saw many patients with that situation. And I really don't want you to be there, because that is really hard and they are really suffering. So let's talk about what is hyperglycemic, meaning the high blood sugar level, okay? So hyperglycemic basically is when you have fasting blood sugar with 130 milligram per deal is really your upper limit, and your for normal Hong Kong person with a British system was 7.2 millimole per liter, which is measured after 8 hours without no eating. And that's where you want to check, because a lot of doctors, before they identify, are you really a diabetes or you have hyperglycemia, they would tell you to do a fasting blood sugar. So take a look, see whether your sugar will be 130 milligram per deal or 7.2 milligram per millimole per liter in the 8 hours after no food, okay? So anything above, you are now in a hyperglycemic, you have high blood sugar already, okay? Now, so the second one is actually we have no, after you eat food, so after meal, the blood sugar level is higher than 180 milligram per deal or over 10 millimole per liter after 2 hours, okay? Measure after 2 hours, your blood sugar should go back to normal, not maintain at 180 milligram per deal or 10 millimole per liter. Now, a lot of pre-diabetic patients, actually, in the pre-diabetic stage, they will experience after food, the blood sugar always goes up, and they will go up more than 10. You have to really worry, because that's mean you continue to go up 10. That's mean you are really approaching a stage of diabetes, especially a pre-diabetic. So try really hard. You got to learn about why you have to measure pre-meal and after meal. And also do a fasting, understand where you're at, okay? Now, hyperglycemia, meaning that high blood sugar can occur not only in diabetic or pre-diabetic. It can occur to anybody, even you have no diabetes. But it will be possible due to like hormonal changes, polycystic ovary syndrome, Cushing syndrome. All that can occur, because when Cushing syndrome, what happens is you have too much hormone or cortisol, and cortisol will basically say you are ready to fight, and will pump up more sugar for you. The body pump more sugar for you to prepare your fight. So net result, your sugar will goes up high as we become hyperglycemia. So this is some of the situation not necessarily occur when you are not diabetes or pre-diabetic. Why I'm still hyperglycemia? That is always can occur because that is the situation. So now, how about other situation? Why causing hyperglycemia? What is the reason? Now, one of the common reason is you don't have enough insulin. The insulin production are not enough to give you take the sugar into the cell, so your blood is continue to go up more and more blood circulating around, so you become hyperglycemia, and that usually occur at type 1 or type 2 diabetes. Now, secondly, is the person who take a lot of carbs. Like I have an engineer guy who drank 4 bubble teas a day. Imagine that, 4. Wow, his blood sugar is high because it's high carb, high sugar. And he said that I gotta have that because without sugar I get tired. And they really used to high blood sugar in the blood into the blood system. However, with that, the sugar continues to spike very high. That's why he's really become a true diabetes very quickly. He's a young guy, 40, almost not quite in 50, but late 40 years old. And he already affected the eyes and everything. That's no good. Now, second is you have a lot of stress or illness. Psychological, emotional stress will also release the hormone called cortisol, which lead to increased blood sugar level. Because when you're stressed, the body says, hey, I need to give you fight, so I need blood sugar for you. So they pump out a lot of sugar for you to go fight. So that is stress, and that will cause hyperglycemia. The hormone condition also lead to insulin resistance, such as Cushing's syndrome, as I mentioned, that the cortisol continue goes up, and you have other situation like gestation diabetic, meaning that your pregnancy, that is also a very common occurrence. And the last one is inherited genetic condition. Now, this is something that there's something totally different in the sense that they have a situation lead to insulin resistant, meaning the insulin comes out, the B cells are no longer function, the damage, and no longer take sugar in the cells. They continue to do that and all that, and that will become an issue with not enough insulin to take care your body needs. You need the insulin to take the sugar to the cell to make sure it got fuel. Now, then you might ask, well, what is the symptom of hyperglycemia? What it is? Now, keep that in mind. A lot of time when you're hyperglycemia, you might have no symptom until too late. Like you're getting to like your blood sugar go up to 200 level millimole per liter, or up to like 10 or no, sorry, I'm talking about 200. Your blood sugar become 200 and higher. You become a lot more realize, hey, my blood sugar is high. Now, for Hong Kong, for people who are high, maybe 11 or 12, before they can start recognize millimole per liter, start recognize I have some hyperglycemic situation. So keep that in mind. But some of the frequent issue will come out is you have frequent urination. Hyperglycemia is always really the body try to get rid of the sugar, so they want to void it out to make urine void it out. So frequent urination is one of the symptoms that you might see in hyperglycemia. Increased thirst is another one, which you feel, wow, I keep drinking water or tea, it doesn't satisfy me. Now, when it gets worse, actually we'll be coming with blurred vision, frequent fatigue and weakness, confusion, headache. These are the common signs. But keep in mind, a lot of time you're hyperglycemia, if your if your blood sugar go up over 200, or in Hong Kong over 11 or 12 millimole per deal, millimole per liter, you might not feel the symptom, but at least you have something that if you have frequent urination and getting thirsty all the time, you need to start checking and poking your finger to understand whether you are having hyperglycemia, meaning the high blood sugar. Okay. Now, One of the complications, which is not good, because when you really continue to high, meaning that your blood sugar going up to 200 or more, 250 or more, eventually you have a situation called diabetic ketoacidosis, meaning the body, this is a very serious condition, because the body, so basically are not really getting the sugar because of the fact that either insulin resistance or not, the blood sugars are continue to be high in bloodstream only. You have a lot of sugar in the bloodstream, but the cells are not getting the sugar. So the cell will tell the body, say, hey, give me more sugar. So what they do is they're going to start breaking the sugar down from what? From basically from the muscles and all that. And then they break down the fat, start bringing everything down to give you that sugar. But with that, even with that, you still not enough insulin to take the sugar into the cells. So that produces ketones, which accumulate in the blood, which lead to so-called acidosis. If you maintain this for a long time, you can die. So make sure you don't get that DKA, diabetic ketoacidosis, as a dangerous stage. So you need to get doctor emergency to help you. One of the symptoms and signs is you have started getting breath or ketone smell. So really, at the end of the day, you need to, if you have that, you got to call ambulance, take you to emergency. Don't wait, because you got to change that condition quickly, okay? Now, on the other hand, some of the time that you might not have DKA, but you will have still a issue of hyperglycemia, which is you become severe dehydrated, and that you also your conscious become you really become less conscious. So that is another dangerous state, but you might not necessarily DKA at that time. So both systems, you can be also life-threatening. You need to call ambulance, to tell friends or yourself, call ambulance to take you to the emergency to take care of that. So that's something that you got to keep in mind. Hyperglycemia cannot maintain for a long period of time. You got to take care of it. If not, you got to get DKA. That's very dangerous. Now, some people tell me, oh, I love to have high blood sugar. That is a wrong idea, because one of my clients actually called me, Andrew, I'm so used to having my blood sugar at 16, meaning that's is like 250 or so. I said, you don't want to be in that stage, because it's damage your blood vessel all the time. It continues to block more and more and more. You got to take care of that. You cannot, because the body, in a way, you kind of like, I'm used to have a lot of sugar, but once I get back my blood sugar lower to 120, for example, they don't feel well. They feel weak. But they also need the body to take care of them to slowly going back to the normal blood sugar level. So that is something that you got to keep in mind. You got to make sure that when that happens, you got to make sure you continue to work with yourself to maintain a lower blood sugar level, but not in a high level. High level is not good for you. It appears just psychologically is good, but it's not good. Okay, so keep that in mind. Now, also, when you're long-term hyperglycemia, what is the problem that will occur? Well, first of all, it will give you a cardiovascular disease, meaning because the blood vessels and the cholesterol, remember I mentioned that, with a high blood sugar will start blocking, forming plaque everywhere. One of the places they can form is your heart. So, matter of fact, 60% of the diabetic patient with heart disease, that is a problem, because in long term, they keep blocking all the coronary artery block. And if the coronary artery block, you know what? You're going to die, because I mentioned earlier before to one of the seminar, I said one of my clients, his blood sugar is very high. We brought it down to 7, but his cholesterol is also very high. Net result, his coronary artery blocked to 96%. If he does not take care of that, he will die. So that's why it's so important. You have to check your heart. Cardiovascular disease is one of the very common for diabetic. Neuropathy, meaning the damage of the nerve. A lot of times people don't realize, you mean diabetic with the nerve? Yes, because all the blood vessels going through nerve damage. So you don't get the feel affect your intestine, it affect everywhere. So you don't feel pain. Your leg will feel numb. You don't feel pain, so injured, so it will get worse, infected. Eventually, you get your leg cut off. So those are common. Okay. Then you have diabetic neuropathy, meaning your kidney failure. So if your kidney failure, you know what? You have to dialyze three to 4 times a day in CAPD or go hemodialysis 3 times. You don't want to do that. It's really a low quality of life. I treat lots of people through Asia who have dialysis. It's really sad, and you don't want to in that boat. And also diabetic retinopathy, meaning that your eye, because our vessels are blocking, and you damage your eye where you cannot see anymore, it's starting blur. And I have an engineer who is 50, late 40, 50 years old. One eye become blur. Hey, you have another 20, 30 years to live, and you can see everything in blur? Oh, come on. I don't want you to do that. You want to take care of that. Don't get into that boat, right? Now, peripheral arterial disease, that is, again, because the heart, your vessel become all hardened. You can be stroke. You can with bursting of the artery. Wow, man, that is all bad stuff. And also you have gastric gut issue, and then teeth and gum issue, which you can continue infection and gum. All that, you can prevent it if you lower your blood sugar. Simple as that. And we can show you how you can do that later on. Now, certainly when you have immediately realized when I take the blood sugar, oh, wow, my blood sugar is high, over 200 and more, you got to take action. So one of the very important things is do fluid replacement. You are in home, you can rehydrate it with sugar-free drink, like Lowsutea. Get Lowsutea drink to reduce the blood sugar level. Drink instead of water, drink Lowsutea. And that will give you, like, for example, you just get a bottle of Lowsutea, 700 ml, drink it. So they will dilute your blood, lower your blood sugar real well. You'll go urination, they will excrete the sugar out. That will help some. Now, if you're in the hospital, they will give you an IV to replenish your body level, reduce the blood sugar. So they will give you sodium chloride solution, basically how to do that. And then certainly that electrolyte replacement, again, this is going to be in the hospital to support your heart muscle, nerve function. And then if your blood sugar continue high, meaning that you're 200, 300, or for Hong Kong will be like 16, 18, 20 millimole per liter. So then you really have to take insulin. They usually give you insulin therapy immediately to help you lower your blood sugar. So people, keep in mind, if you are common people, also common people, you'll get the high, but you have pre-diabetic people or diabetic person, keep in mind, you might not experience symptoms even you have blood sugar greater than 250 milligrams per dil or 40 millimole per liter, okay? Because you are still high, but you might not feel it. One of the common thing you usually see is the body will go excrete more urine. So you want to go urination a lot more. So that is common. So just keep that in mind. Now, for long term, you got to do several things. First, you have to exercise regularly. So net result, exercise will bring down your blood sugar, except you have keto in your urine. That's a different story, but you got to exercise. And so you have to take medication. You have diabetes, you take medication, you take Lowsutea, give you that, help you to really lower your blood sugar, glucose. And certainly you have to have the diet control, meaning a diabetes eating plan, eating smaller portion, half is all vegetable, 1/4 is your protein, which is your fish, low, not red meat, low fat meat, chicken, and so forth. You have to check your blood sugar regularly to make sure you know you're high or low blood sugar. And you probably, if you're in insulin therapy, you have to adjust the insulin to control, make sure it doesn't go up to hyperglycemia. So, meaning that you are now continuing hyperglycemia, you will do that. But do drink Lowsutea will be very important to help you, to basically help you maintain that. Drink Lowsutea naturally daily because it's a good herbal tea that has no caffeine and with a lot of antioxidant, help you lower your blood sugar, cholesterol, and blood pressure level. And bitter melon is one of the two ingredients that bitter melon and also guava leaf, it really help you to increase the bitter melon, increase the insulin sensitivity, so help you to actually take the sugar into the cells and also dump the sugar, cholesterol, and salt out the urine. And basically, so your three high will come down. The sugar, cholesterol, and your blood pressure will come down. Now, very important, continue to eat a balanced diet, rich fruit with vegetable, take a lot of pears, apple, whole grain, lean protein, reduce saturated fat. All of that will help you to basically to lower your to help you to maintain, prevent you to get hyperglycemia. That will be the key. Okay. Now we talk a lot about high blood sugar. So how about the low blood sugar? It's called hypoglycemia. So what's that mean? Hypoglycemia meaning your blood sugar dropped down to below 70 milligram per dil. 70 milligram per dil for the United States. For Hong Kong, and lower than 7.9 millimole per liter. So that's important. So with that, you need to really look at it very quickly, because if you have that, you are basically usually have some sign symptoms showing. And usually hypoglycemia can be related to diabetes or pre-diabetic, but they also can cause by other conditions, which is including people who are not really diabetic issue, but they do have hypoglycemia. But nevertheless, you are pre-diabetic and diabetes, you will have hypoglycemia. That's something that keep that in mind. Now, what is the cause usually? Now, a lot of time, if you have diabetes, your insulin could be the amount of insulin you take could be higher than you require. So your blood sugar are being dropped. So you're taking actually a needle insulin injection. You got to watch your blood sugar more carefully. Make sure don't let it drop. So when excess insulin will happen, also excess hypoglycemic agent like drugs, birth control pills, steroid, blood pressure medication, some of these things can cause you to have hypoglycemia. So when you have too much drug, definitely you have to watch. So that's why you have to take a blood to check whether you're hypo or hyperglycemic. Hypo is more important to also check. If you skip a meal, you take a very little carbohydrate item, insufficient food intake also cause you to have low blood sugar. You'll start feeling weird, weak, hand shaking. And also, especially you already have diabetic drugs, you have all that will come along. Also, except alcohol consumption can also cause the same thing. When you drink a lot of alcohol in an empty stomach, that will disrupt your liver to give you more sugar into the bloodstream, so lead you to a low blood sugar level. And that's happening all the time too. So if you are pre-diabetic, you consume a lot of bread and pasta and so forth. Now, your blood sugar might go up, and that causes hyper. But if you eat a lot of blood sugar item, be diabetic. However, with that, you eat a lot of sugar, but sometimes body responds differently. So even though you are pre-diabetic, somehow your body will try to react, or I gotta get down the sugar real quickly. It might also give you hypoglycemia. Now you are pre-diabetic, I'm talking about, right? Okay, so sort of the body will try to react excessively to say, hey, I need to lower blood sugar. So you're going to start getting some symptom of hypoglycemia. Now, when you have hypoglycemia, you will you definitely will feel the symptom, meaning that you feel shaky, trembling, you feel dizzy, you feel cold sweat, you feel hunger, you have palpitation, your heart go boom, boom, boom. You have different concentration, you feel fatigue or weak, you feel anxiety, headache. The more thing is you're gonna start feeling tingling and numbness of the tongue, cheek. So these are the common symptoms of hypoglycemia. So you gotta, if you have diabetes, you gotta check, you gotta work on it real quick, because your time to get that, you only get like maybe 10, 15 minutes to correct it. If not, you might go fainted. So important when you have that symptom, you have to do something, either hypoglycemia, you gotta treat right away. Now, also at nighttime, there's some hypoglycemia seizure, especially for diabetes patient or pre-diabetic patient. You start getting, damp sheets are sweating at nighttime. You have nightmare. You have confusion. When you wake up, you feel very tired. Those are things that are common in diabetes. Now, when you have severe hypoglycemic symptom, you get confused, lost coordination, slurring of speech, the speech starts getting slurred, your blurred vision, your ability to eat or drink, muscle weakness, nausea, become unresponsive. Sometimes people have seizures. I see patient comes in, getting to hypoglycemia, suddenly just drop on the floor, bang, and that can be happen. So that's why if you have hypoglycemia, you really have to work on it real quick. Now, if your complication can be high, because you can have organ failure, you have cardiac arrhythmia, you can even have cardiac arrest, meaning a heart stop, you have permanent brain damage, seizure, coma, and death. So that's why your time you have to treat really, really fast. And the immediate treatment is basically you have 10, you basically that 15, 20 minutes, you got to consume 15 to 20 grams of fast-acting carbohydrate, such as like glucose tablet or gel, fruit juice, regular soda, honey, sugar candy, without protein or fat. You got to eat that right away, so you can able to basically get the sugar up from the bloodstream. Now, if you are in a hospital, they certainly will give you intravenous IV with glucose, so you get your sugars up very quickly. Now, you have to check your blood sugar level in every 15 minutes. Make sure that you're not continue below 7 milligrams per deal or 3.9 millimole per liter. So how you do that? If you check you're 70 or lower, continue to eat more carbohydrate item, meaning sugar, drink some juice. A lot of time we found that it's fast to drink some juice, a little bit orange juice, that will help you. So repeat that every 15 minutes. Once your blood sugar get back to normal level, you can continue with a healthy snack, prevent another drop of blood sugar, and replenish with your body with the regular blood sugar in the sense that eat normally, that usually work. Now, also, if you continue to have hypoglycemia all the time, you have to go back to talk to your doctor. Make sure the dosage of the medication has the right level. So you got to keep that blood sugar level correctly. Also have to eat regularly. Make sure that you have a snack, taking blood sugar, lower medication. Make sure that you're eating the right carbohydrate, protein, fat to maintain that proper blood sugar level. With the hypoglycemia situation all the time, you have to measure your blood sugar, because if you don't measure your blood sugar, you have no data, and you have to write it down. Don't just took it and don't write it down, because you can show your doctor how it look like. So as you notice, when you're hypoglycemia, your blood sugar only feel a little sugar. When normal body, you have a lot of sugar here, but too much sugar, that's how it look like. So with that, you take good regular diet to maintain proper blood sugar level. You don't want to get yourself to have low blood sugar because you're not enough carbs inside blood sugar level. So that is something that you have to do. Now, as you know, if you're hyperglycemia, definitely Lowsutea can help you lower your high blood sugar, bad cholesterol, high blood pressure, and that definitely helps. So net result, in conclusion, today you learned about two things. Very important. The first one is hyperglycemia, when blood sugar continually goes up. And second one, we'll learn about hypoglycemia, the low blood sugar level down. Now, both actually for diabetes and pre-diabetic, you might have the chance to occur. Most likely you will. And hyperglycemia usually occur is because you don't have enough insulin, or your diet are not enough for taking or because of the fact that you're taking too much high carb diet, stress, illness, medication, all that will cause you to increase hyperglycemia. So not enough insulin, the diet, too much carbs, like keep drinking a lot of bubble teas and stress, you might illness and medication, that will cause you hyperglycemia. Hypoglycemia is when your blood sugar is real low because you have too much insulin, or you have a medication that lower your blood sugar, and also you might not have enough food intake, or you are intense with activities. So all that will cause you to get low blood sugar. The symptom for hyperglycemia is really more if you have too high, over 250 or over 14 millimole per liter. You usually increase thirst, frequent urination, fatigue, blurred vision, headache, but sometimes they have no sign symptoms. So you have to take a blood test to check this out. Hypoglycemia, that's a better thing because you usually have a symptom. You get cold sweat, shaking, irritability, confusion, rapid heartbeat. In a severe case, you feel lost consciousness. And you have to act right away, because you don't act, you might basically go fainted, and that's the end of the deal. So gotta do that. The treatment of hyperglycemia is very simple. You have to manage through insulin therapy. You have to get oral fluid, meaning drink Lowsutea, drink 600 ml or 4 or 5 glasses of Lowsutea that help you to dilute the blood. Medication, you can take medication. You take diet changes, meaning low carb diet, and also do exercise. That will help you to lower the hyperglycemia. Then hypoglycemia, you have to also treat real fast. You have to treat fast acting. Like, for example, candy, orange juice, soda, water, whatever. I mean, sweet soda water, to adjust, get back the sugar into your bloodstream. Certainly with that, you might end up to adjust the medication or diet. So today you have learned two very important concepts, hyperglycemic and hypoglycemia. I hope that will help you understand the difference and what to do. So if you have any question, write to me, andy@wildfarm.com, or WhatsApp me at 6792-9981, 852-6792-9981. But do write to me, because I answer all your mail to give you your question in case you have. And I'm very happy to hear from you. I have a lot of people really enjoy this webinar. They felt that they pick up something. One of the customers that from South Carolina told me, because there's one webinar we talk about breast cancer. She found her lump, and she right away got treated. She was so happy, because we don't talk about a webinar, she would never find the lump. It might be a next stage, and it will get it worse. So do write to me and do listen, and hopefully that you'll be better help. And hopefully that we will give you this overall message every week, and it's free. To give it to you to understand. I'll give you the empowerment to understand what is the pre-diabetic, diabetic, how to prevent yourself from a situation of high cholesterol, lower your blood sugar, not even get into a pre-diabetic stage. If you're a pre-diabetic state, prevent you from going to diabetes state. If you're diabetes state, we reverse you to pre-diabetic state. That's what we're trying to do. So thank you for joining us. Have a nice evening. you for watching and listening to our webinar. Take care. Bye-bye.